Did you know your brain holds about 86 billion neurons, forming countless connections that shape your memories, ideas, and personality? When Alzheimer's disease disrupts these vital links, it can cause forgetfulness, confusion, and changes in everyday behavior. Alzheimer's is the leading cause of dementia worldwide, accounting for 60 to 80% of all cases. It happens as proteins build up in the brain, damaging healthy cells and affecting how you think and remember. Yet, the illness typically starts so gradually that its first warning signs can be overlooked or dismissed as normal aging or stress. Spotting these early clues, however, is crucial. It allows for better planning, possible treatments, and lifestyle changes that may slow the disease's progression. By learning about these signs now, you can help yourself or someone you love recognize them sooner. If you find this information useful, please consider liking, sharing, and subscribing to spread awareness. The first sign to watch for is memory loss that upsets everyday life. We all forget things sometimes, like a new coworker's name or where we set our keys. But memory loss related to Alzheimer's often goes further. A person might forget what they did earlier in the day, or miss important events even after being reminded. They might ask the same questions again and again, not realizing they already asked before. Studies published in Alzheimer's and Dementia, the Journal of the Alzheimer's Association, show that short-term memory is usually affected first. This can be confusing because someone may clearly recall events from decades ago while struggling to remember a conversation from earlier in the morning. The second sign is problems with planning or solving problems. Maybe you used to handle budgeting or cooking complex meals without a hitch, but now you find it much harder to follow a recipe or balance a checkbook. The National Institute on Aging points out that people in early stages of Alzheimer's often have trouble with tasks that require focus, organization, or problem solving. This might cause them to avoid such tasks altogether. If you or someone you know used to enjoy planning family trips, for example, but now seems overwhelmed by making even a small grocery list, this could be a signal that something deeper is going on. The third sign is difficulty completing tasks you once found easy. Driving to a familiar location, operating a TV, or remembering the rules of a card game might suddenly feel confusing. Of course, everyone has an off day once in a while, but if these mistakes happen often, it might mean the brain's procedural memory is being affected. It's common to see people grow frustrated or start to avoid these tasks because they sense something is wrong but can't quite explain it. Families might notice their loved one relying more on them to take over chores or errands. The fourth sign is confusion about time or place. It's normal to forget the day of the week once in a while, especially if you're busy. However, in early Alzheimer's, this confusion becomes a regular issue. A person might get dressed in a coat and scarf in the middle of summer or insist on going to a doctor's appointment that isn't scheduled until next week. In some cases, they might wander off and become lost in an area they've visited many times. This can cause a lot of stress for both the individual and their family, and it can even lead to dangerous situations if they can't find their way home. The fifth sign is trouble with visual or spatial understanding. Alzheimer's can affect the parts of the brain that process what the eyes see. This isn't just needing reading glasses. Someone might have trouble judging distance, recognizing faces, or picking up on color contrasts. They might trip often or struggle to follow objects moving across a screen. The Alzheimer's Association has reported that such issues can appear in the early stages, making it harder for people to drive safely or even walk around the house without bumping into things. These changes can be mistaken for just clumsiness or simple vision problems, so it's important to consider them in context with other signs. Finally, the sixth sign is new problems with words in speaking or writing. Everyone forgets a word or two at times, but people with early Alzheimer's might have a hard time following or joining a conversation. They might stop mid-sentence because they can't find the right word, or they might call common objects by strange names. For example, calling a car a moving box or mixing up words in a way that makes little sense. Over time, these language difficulties can make people feel embarrassed or worried about socializing. Research in the journal Brain shows that changes in language ability can sometimes appear before more obvious memory problems do, making this a key sign to watch for. Putting these signs together, memory loss, trouble planning, difficulty with tasks, confusion about time, place, visual or spatial problems, and word-finding issues can create a clearer picture of potential early-stage Alzheimer's. Sometimes, these things happen here and there for normal reasons like fatigue or stress. But if they happen often and start affecting daily life, it's wise to take action. A doctor can do tests to figure out if Alzheimer's or something else is causing the symptoms. The earlier you know, the more options you have to manage or slow down further decline, which can make life easier for both the person affected and their loved ones. Now that you know the signs, you might wonder how you can lower your risk or help someone who's starting to show these symptoms. While there's no guaranteed way to prevent Alzheimer's, researchers have found some lifestyle habits that seem to support better brain health. A report from the Lancet Commission on Dementia Prevention suggests that staying mentally active can help your brain stay sharp. This could mean doing crossword puzzles, learning a new language, or picking up a new hobby like painting or playing a musical instrument. Physical exercise is important too. Going for daily walks, swimming, or dancing can boost blood flow in the brain and reduce inflammation, which is linked to many health issues, including Alzheimer's. A healthy diet also seems helpful. Eating plenty of fruits, vegetables, whole grains, and foods with omega-3 fats, like fish, can support both your heart and your mind. Diets like the Mediterranean or DASH are often mentioned as good choices for overall brain health. It's also important to keep up with social activities. Connecting with friends, joining a club, or volunteering can stimulate your mind and help prevent feelings of loneliness, which may speed up cognitive decline. If you have health conditions such as diabetes or high blood pressure, managing them properly can also lower your chances of related brain damage. While scientists are still searching for new treatments and possible cures, the good news is that we already know some steps that might help people at risk. Even simple changes can make a difference, especially if started early. Some people also benefit from memory training or therapy sessions designed to keep the brain active. By combining healthy habits with regular checkups and staying alert to possible warning signs, you can give yourself or your loved ones the best chance at maintaining a good quality of life, even if Alzheimer's does become a concern. Alzheimer's disease develops slowly, which is why those 6 early signs we covered can be easy to dismiss at first. Still, repeated memory lapses, trouble planning, difficulty with everyday tasks, confusion about time and place, visual or spatial challenges, and language problems can all be hints that something serious is happening in the brain. If you or someone close to you is showing these signs regularly, it's wise to see a healthcare professional, such as a doctor who specializes in memory or age-related conditions. They can run tests, like brain imaging and blood work, to confirm whether Alzheimer's or something else might be causing the symptoms. If it turns out to be Alzheimer's, catching it early means you can start treatment plans sooner and possibly slow the progression. Getting a diagnosis isn't the end of the road. There are medications that may help manage symptoms, and many communities have support groups where people share tips, talk about their experiences, and find emotional help. The Alzheimer's Association and the Alzheimer's Society have online resources, hotlines, and local chapters that can guide you through the next steps. They can also help you plan for the future, from legal matters to day-to-day routines, making sure you or your loved one has the support needed to feel safe and cared for. If you found this information helpful, please remember to like, share, and subscribe. Your support helps spread the word so that more people might spot these crucial signs in time. Sharing knowledge can spark important conversations about memory health, encouraging early checkups and better long-term care. Staying informed helps you take charge of your own health and also be a guiding light for others who may be feeling worried or confused. Life doesn't stop when Alzheimer's begins, but adjusting to it can be much easier with the right information and a supportive community. The journey of Alzheimer's can be challenging, but awareness is a strong first step. Recognizing the early symptoms can open doors to medications, therapies, and lifestyle changes that keep the mind engaged and active. If you're ever uncertain or overwhelmed, talk to a healthcare professional. It's always better to ask questions and seek answers early than to ignore warning signs that could become more serious. A little knowledge now can make a big difference later, and we hope this video and script empower you to take that next step. Stay well, stay curious, and thank you for joining us to learn about these important signs.